how can care partners feel comfortable speaking up and voicing concerns about care?
Yeah, I think the big thing is that's such a good question because I'm very passionate about patient empowerment. A lot of P's in that statement, but it really is, having good communication with your provider. And I think one important thing is slowing down your provider. Providers, doctors, nurse practitioners, and PAs, these days, there's a lot happening in the clinic. There's a lot going on. And to the provider, this may be, a very routine bispecific antibody initiation, but for you, it's the first time. And so making sure you slow them down, to slow them down. If I think my patients know if I'm running late, it's because I had to slow down and go through the process and make sure it's well understood. And that you should feel comfortable, these days, to ask your doctor question and question your doctor to ask about these therapies, the side effects and the efficacy of them. If your doctor doesn't like it or if your doctor gets angry, then it really is time to find a new doctor. Because the doctor is there to serve you and to help you. And you have to make sure that everything, your questions are answered and that you feel comfortable going home. If you feel uncomfortable going home, then turn around and ask them again.
Yeah, yeah. And if not the doctor, I suppose some of these questions could be answered by someone on the care team.
And so, yeah, and a lot of places have, bispecific teams. I mean, these are such common drugs these days that there are teams of people that are behind the scenes working. And some of the phone numbers are to the other people that are on the team. So absolutely.
You mentioned empowerment. How do you empower care partners to engage in their loved ones' care?
I think that the first thing that I do, this is what I personally do, is I write down everything. I write down, the plan. I write down the mechanism of action. I'm a very visual person, and so I write everything down for patients. And I think when they see me writing down, I hand the papers to them as I write things down, that it shows them that it isn't a one-way street. It isn't me talking to myself in medicalese about a patient. It really is a partnership. And I make sure, and I do this with the trainees, that you never ever walk out of a room without asking, are there any other questions? And I think one very important question for care providers and patients to ask their providers is to ask, is there anything that I should have asked? Is there anything that you think that people normally ask that we may have missed or not gone over? Because, when we go through, because, again, if it's your first time using these medications, you may not have thought of everything and thought of all the questions to ask. So asking your provider, but really having that two-way conversation. And I really do. I really try to make sure that before we give any of these medications, that my patients are engaged, that they understand what we're doing and why we're doing it. And if they don't, then we start all over again. And there is no fault in that at all.